Yes. So one of the things is really matching the PPE to the procedures that you're doing also. Matching the PPE to the requirement. So class, one of the things that we start with that you are going to have hard time to follow through because we know we are going to enforce it is labeling. You don't believe it, but this is actually where you are going to where we are going to hit you hard. What does that mean? So here, as you can see, says all containers must be properly labeled with biohazard symbol, infection control. So just forget let me just make it simple. You are going to get tubes, reagent, and so on. You are going to work on that. From day one, know that if the container is not labeled, you cannot assume what is in it. It could be water. It could also concentrated acid or concentrated alkaline. Think about what will happen with your naked, without gloves if you touch it concentrated acid or alkaline, because that concentrated acid or alkaline, they will look alike just like water, isn't it? So that is why it's not the goggle, the face shield that you use. What comes first is labeling what you are handling, knowing what you are handling. Labeling comes before everything. Labeling, you have to label, you have to keep labeling. If you don't know what is in it, you're taking risk, and that is not acceptable in the lab. But this also say that all containers that all my containers or any, if it has biological material, biohazard, it should be labeled with biohazard label. So when you get into, we have in a classroom for instruction only, we also have 2 labs and a mini store in between. So in those 2 labs, no foods, no drinks, even water, no chewing gum allowed. So absolutely no. Sometimes you come with water, I will tell you, no, remove this one from here. Politely. It's not allowed. It's just on the door. It says no food allowed. No food, drink, or something. Not allowed. But more than that, it's actually the biohazard sign is on the door. So the thing that you handle, if you are going to work on urine sample, no, your urine is, it's biohazard, isn't it? So anything that you handle, also you have biohazard bag to put in. There's a biohazard bag where to throw things in. But before even we do that, we also disinfect our work area before we start and when we finish, or in between if we knew that if it is soiled. And for that, we also look at our infection control manual. So these are the says observe standard precautions. This is a CDC guideline for working with blood and body fluid. So you consider every body fluid is infectious. So that way you handle that with precautions. So recommended hand washing, washing hands before, and then wearing gloves, gowns, coats, and and then washing hands after touching a patient. So in our case, patient is really our specimen because we don't directly necessarily deal with patient, isn't it? But our specimens are our patients. So use PPE. Again, the PPE should match the risk or the type of procedure that you do. They are different, yeah. Actually, face shield, there are face shields that can protect, but masks, yeah, we don't want. You're not only protecting yourself, you're not releasing actually that if you have something, you're not releasing into the classroom. You're putting on a mask, so you're taking a bag to protect the others. So anyway, again, class, the safety measures depends on the procedures that you do. So irrespective of the procedure we do, we have to have masks on. But the safety shield that we have, the face covering, it depends on the type of face covering, the mask, the face covering. Some of them are actually designed to serve both purpose, but once again, we have to look at the procedure, but mask is required across the board. And so we provide gloves, gowns, mask you have to have. We have limited face shields. So depending on the procedure, we will have that. And also, depending on the procedure, do we have plastic aprons? I don't think so. I don't think, because we have just lab coats. So as I said, all containers must be properly labeled and with date and content. So the first day we are going to start lab, I think I'm going to, the first hour, I'm going to get you practice with, I will give you a specimen. Specimen is really practice specimen. Let me look actually who texted, who said that. You can use yours. We're talking about mask. Mask, you always have to bring your own mask, and you have to have mask in order to get into the class event. So no, lab coat will never. Tamara, very good, very good. Let me tell you one thing. Lab coat should be on in the lab. If you are going to go to the restroom, ladies' room, you have to take off the lab coat. You have to take off your gloves. Nothing will leave the lab. Not even going home. Nothing will leave the lab. Not even talking about home. So lab coat should always stays in that lab. Because the lab coat is actually, you putting on that lab coat and you're handling nasty material in the lab, and you take home that you're trying to spread bacteria around. No, we don't do that. We keep everything in the lab. So before leaving, we have to wash our hands, so we don't take that whatever we came in contact in the lab. We try to leave it in the lab. All right. So I think so this is class what I want you to think. This area says all containers must be properly labeled, date and content identified. What it means is that you are going to get, for example, on the first day, you are going to get a colored solution, and then something clear solution. I don't know whether it is, I don't know the name, but it has name on it. Your role actually is you're going to actually get a tube or beaker and get certain amount of the reagent. Your role is then to write to label that the glassware, or whether it is beaker or pipette or whatever it is. You have to label with the content. So for example, we are going to ask you to make bleach. You will have lab duty. On your turn, you have to make bleach. How are we going to make bleach? We will talk. But what is happening is that you make bleach, you name it, you date it, you initial it. If I don't have those three on that, you're not done. If you don't do those three. So I think somebody let me see. Ababa, you wanted to talk and then you gave up. Do you have something to say? Question? That's all right. It's okay. So that is fine. That's fine. So this labeling requirement is what is the first thing to be enforced in the lab, is requiring you to label the thing that you are going to handle. It is a must. So what happens? You're taking tests, and then you got, this is lab test. You got your supplies, specimen, reagent, everything. We already instructed you how to do it, or you may have the procedure. And then normally what I will do is I will bring the supplies, everything organized, and then when you're ready to take, before you get the specimen, before you start testing or performing the procedure, I will ask you if you have question on the procedure. If you have question on the procedure, I will stand there and explain it. You can ask multiple times. I could still, I would do it because that is my job. But once we explain everything and we decided to start the lab, you will be on your own. But what I will do, I will walk around and see if you have labeled your tubes, your cards, reagents, and so on. If you fail to label it, and then I will mark in your paper, tube not labeled, card not labeled, and so on. That way, that is actually going to take points away from you. Why? You are not following instruction. You are not maintaining safety. How do you maintain safety? By labeling, by knowing what you are handling. And there are so many reasons why we do that. For example, you're working in the lab, or you're already certified lab tech, you're working in the lab. You are handling patient specimen. You actually added reagent and you're ready to